We're gonna see if they, if we can
the meeting. Turn on the microphone was the first instruction I got when I walked in the room, and I didn't manage to do that. So thank you. I'll call the meeting to order. My name is Scott Bruner. I'm the Deputy Secretary for the Kansas Department for Aging and Disability Services, and have been part of this project, not quite as long as some of you, but for a while, at least as long as the state's been involved with it. My responsibilities include our licensing and survey of long-term care facilities, and which is not part of this role, but my other role is overseeing the 4 state hospitals, including our psychiatric hospitals at Larned and Osawatomie. And so that illustrates my interest in this building project. I'm going to chair the meeting for today and walk through the agenda. We've got some guests that are online that we'll call on as we go through. Would like this to be as interactive or ask questions as you need to, but I was reminded, and we're going to say it a few extra times because I apparently can't remember it, but if you push the button and use your microphone when you have a question or would like to speak, please do that. So again, thank you for getting together today. There's an agenda that should be at your place that walks through the topics that we're going to go through today. Today's purpose is primarily kind of orientation for the advisory panel to the work that we're charged to do by the governor's office, a few points of guidance and oversight on the Kansas Open Meetings Law, which we're subject to, and also from the county, some of the rules around procurement related to the federal funding, and just, again, rules of the road, not meant to be frightening or scary, but just so that we're all operating from the same set of rules. We'll get a couple of updates from the county as well, and a couple more updates from me. And there is in the executive order opportunities for public comment. So if we have some time at the end, we may see if there's public comment in the room that will be part of the agenda going forward, creating some opportunities for the public to participate as we go forward. And we'll see how much of that happens today. As we start, I would like to do a couple of items of welcome. First from the Sedgwick County, the chairman of the county commission, if you'd like to say a few words, and then we'll have Secretary Laura Howard provide a few words of welcome as well.
Okay. Well, good afternoon, everybody, and welcome. What a looking around at this panel, what a distinguished group of members here on this. And I just, on behalf of Sedgwick County Commission, and like to welcome you all. And Scott, you did a nice job of recapping today's meetings, what you're going to try to do. I would say because of COVID and then the CARES money and then the ARPA money, we as a commission are very familiar with what we can and can't do with those money and with the rules around it. And you will hear about that, which is pretty important. And then I just want to thank the governor's office for putting you all together. And historically, I'm glad the sheriff is here and Mark Bennett. And I think this started from the awareness that the mental health adjudicating people to stand trial or serve their time was getting to be a huge burden on the largest population in the city or in the state, our city here. And so it started as let's say a little bit of a, Representative Henry, you were familiar with it. We were kind of saying, hey, we need help. We can't get them all up at Osawatomie, staffing, all the reasons. And I think it was good for the state to get together with local government and local communities and say, well, we've kind of analyzed this, and we think a new state facility here in this region, no matter where it's at, would be not only beneficial for here, but beneficial to the state in whole, with the population that we have, that we can, in our recent efforts in medical world, to have internships and address some of this mental health issue. Is no longer is it an issue that's not talked about. It's very much a part of our fabric. So I just want to welcome you and congratulate you, and appreciate Sarah Lopez, Commissioner Lopez, is our appointment as a commissioner to this committee. And then you've got some pretty good staff people, and And I look forward to any questions, and I'll move on. Don't see any questions, so
Great.
I had my 5 minutes. Thank you, Scott. Scott, thanks
Thank
a lot, and good and best wishes for everything. And we'll always be available.
Thank you. Thank you. Secretary Howard, would you like to provide a welcome for the group?
I sure would. Thank you, Scott. I'm sorry I wasn't able to be with you in person today, but I'm really delighted to jump on with you for a few minutes to, first of all, really just to thank everyone for agreeing to serve on this advisory panel and to welcome you to the first meeting. You know, what are we really here about? You know, as the chair said, more than anything, we're about planning, designing, and ultimately constructing a 50-bed regional psychiatric hospital in South Central Kansas. And when it's all said and done, a state hospital that becomes part of our state hospital system. And as was alluded to earlier, this will fill a couple of different roles. It'll address a lack of psychiatric beds. It'll provide psychiatric beds closer to home for some individuals. And it'll also it'll also address some of the backlog issues related to competency evaluation and restoration. Now, I'm really, really grateful to the governor, to the legislature, to those involved in the SPARK process related to federal relief dollars, that sufficient funding has been set aside to construct and operate a new state facility, again, through both state and federal relief dollars. You know, I'd like to give a special shout out to our colleagues at Sedgwick County, and just really for your leadership, really for your foresight regarding this project, for reaching out with an ask through the SPARK process, for your advocacy during the legislative sessions for really a couple years and during an interim as well, and really for your willingness to join hands with the state in carrying out the steps necessary to end up with a regional psychiatric hospital there in South Central Kansas. I have no doubt that this collaborative model is leading to a more expeditious and constructive process. And I'm very aware to the members from the county that you're doing a lot of the heavy lifting at the front end of the project, and we really, really appreciate that. To those of you on the advisory panel, again, thank you for stepping up to serve on the advisory panel when the governor invited you to. I really look forward to hearing the insights you bring to the process. Your input will be especially valuable in helping the state and the county to design robust processes for public input, you know, to keep a focus on the issue of workforce development, and then really ultimately helping us discern the best operating model for the new facility. So it's an exciting start today for the panel. I know you have a busy agenda, so I will hand this back to Scott, Deputy Secretary Bruner, and I thank him also for his willingness to serve in my stead as the chair for the committee. So thank everybody. I look forward to what comes out of these series of meetings. Thank you so much.
Secretary, are there any questions that anybody has for the secretary while we have her? Okay. They both did a good job of summarizing why we're here, which I just completely blew past as the level first step. You ought to talk about what we're trying to build, but we'll talk more about that. So I think we're okay moving forward. So thanks to the chairman and secretary for their welcome. Maybe as the next item on the agenda is just to have the panel do some introductions. Many of you know each other already from other work that you've done in the county. Some are new, and some of our legislative members are not from this area. So I think we'll just work our way around the table and have folks do introductions. If you could provide your name, which is on your name tent, so that shouldn't be hard, and who you represent or where you work. And then if you wouldn't mind, maybe one question you've got about this project or the process or what we're doing here that you're looking for an answer to or to discuss. Claudio, may I ask you to go first?
Sure, I'm Claudio Ferraro. I'm the president of Ascension Via Christi Hospital, St. Joseph. I've been with the organization for about 31 years. I've recently replaced Robin Chadwick. I do think she is on the call as well. Really looking forward to participating in this discussion. It's a complex issue. but I know we have some great minds, so I'm excited to see that. And really for it to succeed, it's got to be additive all the way around, and so we also want to, bolster the talent pool as well in the region. So I think that's an opportunity I look forward to having a discussion on.
Representative Henry Helgerson from East Wichita.
Representative Will Carpenter, El Dorado.
I'm Joan Tammany, Executive Director here at ComCare in Sedgwick County. And I think, like Claudio just shared, my whole focus and interest in being on this is making sure that the services are additive to our community and not cannibalizing existing resources, and making sure that we increase the talent pool rather than tap into it.
Mary Jones, Mental Health Association of South Central Kansas, and I really echo what's being said here. I think those are top of mind for the community providers.
I'm Sarah Lopez, Central County Commissioner for the 2nd District. My background is in healthcare. I worked with Ascension Christi for 16 years, clinical and then IT. So excited to be able to be a part of this as well. I'm going to just kind of repeat what everybody said. Really, the workforce issue is one that I want to make sure that we get right, because I would hate to see us pull from everywhere else and make a problem worse for others when we're trying to do better.
Good afternoon. I'm Secretary Yusha Reddy. I represent District 22, which encompasses Clay Center, Geary County, as well as Riley. But also we have a Via Christi there, and I'm part of several mental health organizations. And I think one of my major concerns is, how does this impact the entire state? Because we have such a need for beds, and we have also Otomy and all of these other ones. But because this is based in Wichita, how will the other communities have access to it as well? Thank you.
I'm Tom Stolz. I'm the Sedgwick County Manager, and I don't want to speak for the sheriff or DA. They'll get their turn, but our number one goal was to try to help our criminal justice system here process people fairly and equitably. And then I agree. I think we can do some. There could be some assistance on workforce here. And then finally, I just think this is a project which allows us to do right by people, to give people the best service and move them through a system and not bog them down and keep them in a place where they shouldn't be, which is generally a jail or an ER. So look forward to working with you all.
Good afternoon. I'm Jason Gregory. So I work for the Greater Wichita Partnership and Downtown Wichita Economic Development. So we help lead not only Wichita and Sedgwick County, but really focus on the 9-county region that is South Central Kansas. So if we want to continue to grow as a region, this is an issue that we've got to address. And we work also hand in hand in talent initiatives. And so the workforce issue that's been brought up, I think we're definitely supportive of that.
Mark Bennett, District Attorney. As the manager alluded to a moment ago, the criminal justice system is what I'm here to represent, and the impact of mental health, access to mental health treatment, access to beds at Lawrence State Hospital, which is our catchment area, have long been an issue here. And the bottom line, we're paying for this right now as it is. We're just paying through the sheriff's budget, mine. We're paying through the court system, paying on the back end DOC. And I think I don't know of a less efficient way to do it than we're doing it now. So this is a first necessary step. I will say the one sort of overarching issue to me in the back of my mind in all of this is physically where this hospital is going to be is a major decision to be made, because it will impact a lot of downstream decisions in other respects, where other things will go, where people will where other decisions will be made. So I think that's my big unknown.
My name is Latasha St. Arnaud, and I'm the president and CEO at Humankind Ministries. We are the largest homeless service and housing provider in the region. We serve South Central Kansas. And I think everyone has said pretty much what's been on my mind. I'll just say, for us in particular, making sure that services are available and accessible to those that need them most.
Thank you. Jeff Eastwood, the Sedgwick County Sheriff's Office. I appreciate the opportunity to be on the board to serve with everybody. Ditto to pretty much everything else that was said. The only thing I would add that I'm interested in is the realignment of the catchment areas, because this should be for South Central region part of Kansas, which will free up tons of beds at Osawatomie and Larned that are currently occupied simply by our folks, which will help the rest of the state. So thank you for having me.
Representative Hobson, if you're able to unmute. Yeah, please go ahead. Introduce yourself.
Thank you, everyone. My name is State Representative KCO Hobson. I'm actually a representative, represent the northeast part of Wichita. Glad to be part of this advisory panel. So far, I concur with all that's been said. Of course, this is a major issue that's in our that we need to tackle in our region. So I look forward to whatever contribution I can make to make this panel successful. Thank you.
Thank you all for introducing yourselves. I didn't share what my question was, but the one issue that, in addition to workforce, which operating 2 hospitals already and facing the staffing challenges, which aren't new to anybody else, but is how we fit the services of this hospital into this regional area and community. It's important. We don't have the same kind of urban setting at Larned and Osawatomie, so that's new to us. But I think, again, with the partnership and the way this has been developed as a concept and the other work that really the county and city are leading efforts on, I think there's really real opportunity there. And again, I think a group like this that has the variety of interests and perspectives is a good way to, I hesitate to use the word ensure, but best possible outcome in terms of integration and making it make sense. Law enforcement with the judicial system, existing community services, and the other places where because all of our patients are people who are going to be back in this community or ones close by. So fitting into that overall network is really important. And I don't have a simple answer for it. So that's one that we'll explore together. So thanks for taking just a minute to introduce yourselves. And please, if you have other questions, there's lots. I probably should also say, I don't expect anybody to be an expert in mental health or running hospitals if you're not already an expert in mental health or running hospitals. So there'll be lots to learn. All questions are good questions. Please feel free to ask as they come up. I did want to, before we get into a couple of the presentations about the Open Records Act and the procurement process, I did just want to review the executive order and our charge. Just again, you all can read, but I do feel like we ought to make sure we're all on the same page. And in particular, I wanted to emphasize our deadlines, which is much more for me than all of you individually. But I did want to make a point of it that we've got some timelines that are laid out and that we need to meet. So at your table, we made copies of the packet of material that we sent out in advance, and the first item is the executive order. You can see the kind of charge on the first page, which is interesting. But again, we'll meet every month or most months. That's the charge. We'll meet in Sedgwick County. And again, we'll have a virtual option available for folks who need to use that, but we'll be here with our meetings. Item number 7, the executive order, we have an interim report that's due to the county commission and the governor by January 15th of 2024. So right after the 1st of this year. That interim report can reflect whatever we would like as a group. So we will need to take some time in a meeting in December, probably, or probably in December to kind of go through what those recommendations might be or things that we want to see in the report. So keep that in mind. Our final report as a panel is due by June 30 of 2024. That date's deliberate and timed around decisions with the building project and procurement process. So many of the things about the programmatic design, how we fit into the services here in Sedgwick County and South Central Kansas, we need to have pretty well figured out, or at least be on a path. Not before the building is complete, but as we're building. So that's why that date's there, but another year or so out. In terms of the tasks for the panel are listed out in number 8 on the executive order, and they are in order. As we were drafting this, we listed all these items almost in the same order, but as we talked with the governor's office and the governor about it, we did think there was a sequence that made logical sense. Some things are more urgent to put at the front than closer to the back of the time period, in given what our reporting dates are. But so the first task is to gather public input on the needs and location for a regional psychiatric hospital, including how the state hospital would fit into existing services and plans in Sedgwick County and South Central Kansas. Much of that is work that a special legislative committee started on last summer, and there's some evidence base and information base to build on, but really documenting the need and purpose, and that the rationale is an important part of that first step, including barriers and gaps in care. So you can think about that. Second is recommendations on the workforce development that's needed to staff a regional psychiatric hospital, training pipeline, kind of all the topics about workforce that Joan mentioned and others. We want this to be an additive process and not just take staff from ComCare or Via Christi, but really figure out how we grow the whole workforce and meet all of those needs across the system. Third, make recommendations about the operating model for a regional psychiatric hospital. That the operating model means how it fits into existing services, but also could include whether it's run. It will be a state operated hospital, but we can choose between running it with state employees or contracting out some parts. And so recommendations around that choice, it again makes sense to have early in the process. Fourth, any statutory changes that we need to operate this as a state psychiatric hospital, including the catchment area, which a couple of you mentioned, the scope of practice, how things cooperate together. We could make that recommendation before the 2024 session that's going to happen in January. That's probably ambitious, or unless it's just obvious, which I'm pretty sure it's not. But we definitely need to have a recommendation, if not for this session, by the next session in 2025. So that's the order of things that we'll progress through. Our first task will be gathering that public input and structuring that. And I'll talk a little bit more about that maybe near the end of the agenda. But getting that, documenting that need, again, that's been done in the community for a while. That got us to this point of having the funding appropriated to build the building. So that's pretty straightforward. But it's a good time to refresh, rethink, and update that as necessary. But also then talk about the location and where that might make sense and where the public would want to weigh in on those issues. Are any questions about the charge or direction that I can answer, or that you have with that amount of background? Okay, that's great. So the easiest group that I work with on a regular basis. So I appreciate that very much. And we can come back to that anytime. We did think it was important to brief you all on the Open Meetings Act. We are subject to that by the executive order. Again, it's not meant to be a scary thing or something to be concerned about, but it is good to know the rules, and particularly with folks that we have that work for the county. There's some overlap or where things intermesh. So we're going to start with a presentation from our general counsel, Sherry Deal. And she's got some slides that I handed out and are at your table. The county councilor, Justin Wagner's here as well, and he's got some slides that we may show. They overlap a little bit. So we're going to let Sherry go first and walk you through the slide deck that was on your at your place, and highlight those things. And then we'll have Justin do a little highlight or summary for the county position as well. So Sherry, with that, if you want to go ahead.
Hi, good afternoon. KSA 754317 at SEEK is where the Kansas Open Meetings Act sits. It recognizes that a representative government is dependent upon an informed electorate, and it declares the policy of the state of Kansas is one where the meetings for the conduct of government affairs and the transaction of governmental business shall be open. So everything kind of that we're talking about today is about, is based upon that premise. There's three things that must occur for a meeting to be open. And I'm on slide 6, if you're looking at the slides. And that's a gathering or assembly of persons that either by telephone or any other medium, in person, or by interactive communication that involves a majority of the membership of a public body and for the purpose of discussing business affairs of the public body. So basically you would take how many members you have and divide that in half and add 1, and that's your majority of your membership. And if there's those persons together and they're discussing business of the public body, no matter where you're at, whether you're in this meeting or you're somewhere else, you are conducting business of the affairs of the public body. So on slide 7, if you're, involved in informal discussions, you take a recess before, after, or during the meeting that you're in today, or anytime that this group is meeting, and you're outside of this formal meeting, you could be conducting an actual meeting as well. Any kind of informal discussions that you get into that is involved with a majority of your membership. And basically the name of the gathering is irrelevant. So if you go somewhere else after the meeting and you decide to have coffee, or before the meeting you decide to have lunch together and you start talking about the business of this group, that is a meeting, and you could be in violation of the Open Meetings Act. We call it COMA, if there hasn't been proper notice of that. Basically, for COMA, it doesn't require that binding action or voting occurs. It means that there just has to be discussion of the business affairs that triggers the requirements for COMA. So a meeting includes all gatherings at all stages of the decision-making process. So anytime you guys go away from this setting and happen to be in some other type of setting, just remember that these rules can apply. It also can apply in serial communications, like if you get on an email thread and then forward or pass the email on, you say you get 3 members in an email and then it gets forwarded and gets forward, that can become a meeting for COMA purposes. So the general rules we tell persons that are involved with open meetings is do not reply all and do not forward. Because those interactive communications outside of a notice meeting may be a violation of COMA. Really the only topic that should be discussed in emails and that kind of thing outside of a COMA meeting is, the scheduling, your availability of when you can meet next, that kind of thing. As far as COMA goes, there's no really procedures for meetings as far as publication on a website or certain newspaper or anything like that. But there was an executive order back in 2018 under then Governor Collier that created an open meetings website. For state purposes, we usually put our notices in one specific area on one specific website. As far as that goes, it also doesn't require that you maintain an agenda. But if you do, if someone requests it, you need to provide them an agenda. It doesn't mean that you can't, amend the agenda later. You always can do that. As far as any kind of use of cameras, those are allowed. The public may record sessions of the meeting as long as it's not disruptive. And they can use, they are subject to reasonable rules to ensure orderly conduct of the meetings. So basically any person may attend your meetings, but they do not have the right to speak at the meetings or have an item placed on your agenda. Minutes are only required to record motions that go into an executive session, but there may be other policies or whatever that require that minutes be kept. And I'm going to just kind of sign off for you and go to Mr. Wagner's presentation. Executive sessions have very specific procedural rules. If there is a need for you guys to go into an executive session, that's probably something that you need a script to do. And so you probably need to reach out to Mr. Wagner or myself if that's something that you believe that you may need. I can't think of very many reasons that you would go into executive session for this panel. If you need to meet with attorneys, legal counsel, that may be one. One that kind of stuck out to me is preliminary discussions relating to acquisition, not the sale of real estate. So if you're looking at a specific plot for possible placement of this hospital, you wouldn't want that discussed out in open public meetings, because somebody might raise the price of that land if they knew it was under consideration. So that might be a reason to go into an executive session. But in order to do that, it is something that there are a lot of procedures to that. So you'd want to reach out to your legal counsel in order to do that. And that's all I have today. I'll be glad to answer any questions after Mr. Wagner.
Okay, thanks.
Hello, good afternoon. Justin Wagner, Sedgwick County Councilor. I think you've all already heard a very good presentation on the Kansas Open Meetings Act. I'll go through my presentation, but in an abbreviated fashion here. The first thing I was going to mention is that one of the things, and I believe Mr. Bruner already mentioned this, that the executive order does contemplate that the advisory panel, you all can form sub-panels. If you would form any sub-panels, those would also be subject to the Kansas Open Meetings Act. I think that's something to keep in mind if you guys go about doing that. Also, and there's discussion about this in the second bullet on there, because there's 14 of you on this panel, majority would be 8. That's also your quorum for meeting. It's important to know what's not a meeting, but you can read it on the slide if you've already got it. I won't go through each of those. One thing I did mention on what could be a meeting, there's one of the bullets on there that talks about if, let's say, 8 or more of you would comment on a social media post dealing with what this advisory panel is doing, that in theory could end up being an Open Meetings Act violation. So be careful about commenting on social media on matters that you're dealing with, because that can actually result in an open meeting occurring over social media. Move ahead a couple slides here. There's already been talk about what the act actually requires. The second bullet point on here, I'd note that, and you guys already know this, that you can participate remotely. Meetings should still happen in person, but I think they can be supplemented by either telephone or Zoom or other means of participating. And specifically on 5 of you are Sedgwick County officials. And so in your roles as Sedgwick County officials, it's inevitable, I think, really, whether it's at county commission meetings or private meetings, that some group out of the 5 of you may talk about business that are involving the overall panel. And I'm not here to say that you can't do that. But I did want to mention that because of that, I think it's worth noting what your responsibilities are and keeping that in mind. You're serving an advisory capacity to the governor, KDADS, and Sedgwick County Board of County Commissioners. And then also your actions are just advisory under the executive order. For the Sedgwick County officials, like I said, you may end up talking amongst yourselves about certain things between the 5 of you, but of course, then you're not getting up to 8 people. But one thing I would suggest is kind of a rule of thumb. It's not saying the Kansas Open Meetings Act necessarily requires it, but a suggestion that I would have, because we're dealing with some of the money that's being at issue here is under ARPA, and Lindsay Poe-Rousseau is going to talk in more detail about the ARPA requirements. But even the appearance of impropriety can cause issues with that money. And so while there's no limitation on the 5 Sedgwick County members talking to the 9 non-Sedgwick County members, I think it might be advisable as a rule of thumb to try to avoid that discussions about any of your business outside the confines of one of these open meetings. Again, erring on the side of caution and also in light of ARPA. But do let me know if you have any questions on that. I've also put a link on here if you've got it in electronic format, but I believe it had already been mentioned. There's a website that KDADS is maintaining for the public to be able to get notices and agendas. With that, I'd be happy to stand for any questions if you have them.
Are there any questions for Mr. Wagner or Sherry Deal, the KDADS council?
Thank you so much.
Thank you. Nobody's getting up to leave, or that didn't scare anybody off. So Ken, another good start. If there are other questions that come up about COMA or a particular interaction, something that happens down the road, don't hesitate to reach out and we can connect you with either council or both as we need to answer those questions. So next on the agenda, I just wanted to go through the material that we'd sent out in advance, just kind of the contextual pieces for your reference. And I won't read them all to you, but just so you know what's there and how we thought they would be useful. And it's in the packet that's on that's at your spot. So it's a copy of the executive order, which we've already talked about. The second document is the memorandum of understanding between the county and KDADS. This is the agreement that we entered last spring to be able to transfer money from the state to the county to undertake parts of the construction project, the initial design, and some of the work, and set the framework for ongoing discussions as the additional funding became available. So it describes the relationship, how things will work, how we will communicate with each other and share information. But the fundamental part of it is to make available part of the appropriation that KDADS has for the hospital construction and operation for the project, but also the ARPA, the federal COVID relief money that's been appropriated for the project through the legislature and the Spark Executive Committee process, how that would flow and how those things fit together. So it's really our governing document for the relationship. We'll probably have some additional agreements that we'll need with the county as we move forward with the construction project, but that's the first thing that we had in place to define the relationship. The next document is the final report of the Special Committee on Mental Health Beds to the 2023 legislature. This is the report from the special committee that met over last summer, directed by the legislature to study the needs for a regional psychiatric hospital and mental health beds generally. Some questions about practice. It did also connect to the $15 million that was included in the governor's budget for this project that the legislature said, hold on to that. We agree to spend that money. We'll appropriate that money, but we want it to be released after this committee met and made recommendations about how it ought to be used. So there's a lot of good information in the whole body of the report. There's a couple of pages at the beginning that are the highlighted recommendations from the committee. which again are really the driving force behind the project, to have $15 million for the building project that's part of the KDADS budget, that we should work with Sedgwick County to design and do the construction work for a 50-bed facility here in the area, in the region, since it doesn't determine the location. It does identify 50 beds with the ability to expand up to 100. And so you'll hear both numbers discussed, and that's part of the charge. And then the scale is probably more subject to how much money is available than any other of the questions. And that the other kind of key recommendation is that there's $40 million of American Rescue Plan funding that Sedgwick County requested through the Spark application process, that the committee recommended awarding to the county for the purposes of building this hospital building. There's a lot of other information in there. I don't remember how many hearings there were, but 3 or 4. Lots of public comment about the needs in Sedgwick County, what hospitals are seeing, law enforcement as well, workforce pipeline. So many of the questions that you raised already, and that was a little bit point in time last summer, but at least a good start. And those may be some, as you read through that or look through that, if there are some of those folks who weighed in during that committee process that you'd like to hear from again, or see if they would update their testimony, we can go back and ask for that as well. The next document that's in the packet is a list and a map of existing mental health and psychiatric hospital beds around the state by region. So the Kansas Legislative Research Department asked, as part of the work of the special committee, to count how many beds there were available around the state by category. Some of those are the hospitals that we operate at the state level. There's a number of private psychiatric hospitals that have mental health beds, and we identified those numbers as well. Then there are a couple of other categories of not inpatient psychiatric hospital beds, but kind of critical parts of the system to address the needs of people in mental health crisis. Those are called crisis intervention centers and crisis stabilization centers. Again, they're not full inpatient hospitals, but they are kind of in the system design, the first place that somebody would go when they're in a mental health crisis, short of being in an emergency room or going to a state hospital. So the document, it counts those beds up to get to a total. And then the map shows where those are located around the state, again, also by type. We get asked that question quite a bit of, how many beds do we need? That's the big question. But the other is, where are the existing beds? How many are there? Are they all in use? And so we thought that'd be a helpful thing just to provide you some more context. The last document is a memo that the Legislative Research Department put together for that special committee that really goes through the history of mental health hospitals in the country, the roles that they played historically, and then the origins and sort of what's happened in the founding of Osawatomie State Hospital and Larned State Hospital and how those have changed and over time. And again, we thought that was helpful since we're talking about a state psychiatric hospital. Wanted to share what that means in our current context, but and historically, but also what that might look like here in Sedgwick County. And then the last part of that memo, which is important to highlight, is we've made a significant shift in the public mental health system, at least from institutional inpatient beds with a significant capacity to a much smaller inpatient psychiatric acute treatment model, and serving many more people in community settings through community mental health centers or certified community behavioral health centers, local services at the community level. In Kansas in particular, that's become much more of the focus of mental health spending and services, is really meeting people in the community. And where there is a psychiatric hospital or an inpatient bed, it's much more of a short-term acute stabilization and then discharge to community services and keeping people stable as much as possible in the community. Again, important context of We're not building a hospital to house people for long terms generally, but it's a stabilization, discharge, and then kind of gap filling from there. But again, just wanted to give you the historical context, and they did a nice job putting that memo together of summarizing. You can read whole textbooks on that subject in Kansas and nationally, but we thought that was a good summary again for context. That's what we provided in advance. We're happy to do more reason, and I say we, me and my team, to provide more background information, data as you might think necessary, research on particular topics. Happy to do that additional work and bring it back to the group. Are there specific things? You can certainly think about it too. That's a lot to absorb all at once. But if there are particular questions you'd like us to look at or information to find, data to gather, happy to start working on that so we can get that back to you to inform your ongoing discussions. Oh, sorry, Senator.
Thank you. So I have a few questions. I want to know the capacity or if the need for voluntary and involuntary. So I see the numbers here, but I don't know which ones are voluntary facilities and involuntary. And if we're looking at the psychiatric hospital, when you say it's a short term, well, what exactly does that mean if it's an involuntary patient and such?
That's a great question. So all of the state hospital beds that are listed on that chart at Osawatomie and Larned are involuntary beds. So to be admitted to Larned or Osawatomie, you have to be declared by the court to be in need of care and treatment. And so we're suspending your civil rights and placing you in the state hospital in the care of the secretary. We do admit voluntary patients. We can admit voluntary patients on both campuses, but it's limited based on our census. And so our policy is at 85% capacity of our licensed bed capacity. We no longer accept a voluntary admission. We only take involuntary. And we've been at 85% capacity on both campuses for the last two years for sure, since we looked at the moratorium at Osawatomie. The private psychiatric hospitals that are on here, or the beds that are listed, those would be, they're not involuntary. You're a voluntary patient. You've decided to be admitted there and you can leave when you want, but all the state hospital beds would be considered involuntary. And in terms of treatment, our average length of stay at Osawatomie is around 12 days, 12 to 14. And at Larned, it's a little bit longer, but in the 16 to 25 days. Yeah.
One question on, there's 50 bed recommendation, but you also see with the capacity to go to 100. How did they, when they base the number of beds, is that primarily funding driven, or is that also workforce consideration, or is it both?
Let others weigh in on the 50 beds. When we looked at it from the state perspective, or we put it in our budget, what we looked at was admissions to both Larned and Osawatomie from Sedgwick County and the surrounding counties, and both involuntary commitments and our care and treat, or our forensic commitment. So cases that are waiting to have their competency evaluated or restored to go through the criminal process. So when we took all of those patients together that were coming from Sedgwick County, it was a little over, but close to 50. And so we said, if we're building a facility to serve this region, more narrowly defined than the executive order would talk about, but just Sedgwick County, 50 beds seemed like about the right to deal with what our, a couple year average of placements were. But others may have that was also, the 50 beds was also in the county's recommendation as part of their policy direction. So I think we kind of got to the same place using the same sort of information, but others from the county may have a different thought about the genesis of the number.
Well, thank you, Scott. So you might mention the state institutional alternative beds, just kind of clarify that.
No, that's a good, sorry. So 2 years ago, so from the state perspective, one of the initiative that we had to deal with capacity, if you need more beds for involuntary patients that have care and treatment orders, we could build more state hospital beds as we were looking at this 2 years ago, which is a slow process. We don't have any additional buildings on the at the Osawatomie or Larned campus that we could convert and use. So we thought we tried to come up with a way to add more capacity to the system, particularly for involuntary admissions that would otherwise go to a state hospital. And our solution to that was to partner with community hospitals who already had psychiatric units or psychiatric beds and ask them to take involuntary admissions, involuntary commitment patients, as though they were operating a state hospital. And we call it the state institutional alternative. So as part of we have contracts with 9 hospitals around the state. They're indicated on the map. And that contract, we pay those hospitals a daily rate to provide the equivalent care that patient would have received at a state hospital on our campus. And so over the last, since August 2022, 2021, when we put that in place, we've served about 1,700 adults, which is the equivalent of if we had added 17 beds to our system over that time period. So it's been a good way to, the gatekeeping is the same. So the screening process for a state hospital start at the beginning. So if you're in a mental health crisis and you're in a community hospital's emergency department, brought there by law enforcement or somebody else, the first step for state hospital admission is to be screened. And we have a uniform screen across the state that our community mental health center partners screen that person's need for a state hospital stay. And before we had the SIA hospitals, the option was either you go to Larned or you go to Osawatomie. And with the state institutional alternative hospitals, the options are you could go to a community hospital that's closer to where you live, get the same level of care. And then when you discharge from there, you're back in the community setting and you're not waiting for that state hospital bed. So those beds operate the same. They're run by the community hospital. They're not physically in a separate place. They're just a different designation and different payment rate for that level of care. And we are serving both adults and children.
So I have a question as a follow-up. Well, several questions actually. Do you check insurance, or is this open to anybody in the public that is having a crisis at the moment? And how do you, let's say they don't have insurance, is the state taking care of that care, or where does it fall?
We don't examine ability to pay or payment source during the screen. So if the person's Medicaid eligible, it is a Medicaid reimbursable service. If the person's not Medicaid eligible, KDADS pays the same rate, but we pay it out of state funds. And it's a level of care that private insurance doesn't pay for. So that isn't as much of a question, but that would be a third place it would go.
Can we have data on how much that is, how much that's costing if you're partnered with 9 hospitals, is what I'm hearing you say, for that type of care for anybody who needs that type of crisis information? Thanks.
Yeah, we can. I would guess, but I would get the number wrong. So or an informed guess. But we can make that available, sure. Those are great questions.
I don't have a mental health reform or question of that nature, but just remind me, because I can't keep it in my head, the ARPA dates, the deadlines and such that have to be maintained for spending.
I'm going to turn around and phone a friend.
Can I speak to that during my next agenda?
Sure, that'd be great. love public opportunities to point out the limits of what I can remember. So thanks for that. Any other questions or data pieces? And that's an open question. We can certainly come back to it.
I just have one clarity question because the state hospital that is being talked about is adult. And yet you mentioned SIA for teens. Do you want to make clarity there? Not part of this bill.
Right. So our model in Kansas is to not use state hospitals for children and youth. All of our state hospital beds are for adults only. And our preferred treatment model is to serve kids, even kids in acute mental health crisis in their communities. Although courts can decide that a child or a youth needs an involuntary commitment. And so we do have to have places where that level of care can happen. And we use the SIA model for that. That's a good question.
Thank you.
Sure. No, it's a good question. Okay. So that's what's in your packet. And again, if you have, as we work going forward, there's a research item, data question, whatever it might be, we can certainly work on getting those answers going forward. Next, we gave you the admonition about open meetings. We thought it would be good to share a similar set of best practices on ARPA and the building project. And our friends at Sedgwick County have done a really good job of clarifying this for other purposes, and we've relied on it quite a bit. So, Lindsay, if you wouldn't mind going ahead and providing that update.
It's my pleasure. Thank you. I'm Lindsay Poruso. I am the CFO for Sedgwick County, and Sedgwick County has been fortunate enough to receive $100 million directly from the federal government through ARPA. So we have learned all of the details far more than we ever wanted to know. And I feel bad for the county folks who are sitting in the room who are going to hear my sermon on this for like the 18th time. But I will try and keep it quick. So you all heard of CARES. CARES was a response bill. And so we were able to move quickly and had a lot of flexibility with those funds. ARPA, however, is a recovery bill. And so what that means is the federal government invoked the full spectrum of their grant uniform guidance. So the whole rule book, and I am telling you, it's multiple books and it's very thick, but they invoked all of that for this ARPA funding. And so there are a few things that I want to highlight for you all, because you all are obviously in very prominent positions related to this very expensive, very high profile mental health hospital that's going to be located in the South Central region. And so you are primed to be hit up by very well-meaning, well-intentioned people about what's going to happen, trying to get an inside track, or maybe just making sure they're on your radar. And unfortunately, as well-intentioned as those folks may be, it's not allowed for you to talk to them or really them to talk to you about this. So some of the rules to hit on, and then we'll get to the timeline too. When it comes to procurement, the federal government is concerned about everyone having equal access to information and equal access to find ways to this money. Now, Sedgwick County has been awarded essentially through this process $40 million. $15 million of that is from the state general fund, and we're using that for a lot of the upfront costs. And then we're receiving $25 million for the actual construction. So that's where the rubber meets the road. So for those projects, what we have set up here at the county is a website. If you go to our front page, sedgwickcounty.org, there's a little ARPA box. And folks can click on that little ARPA box. And when they click on that, what then they will see is a list that at the bottom says State Mental Health Hospital, and they can click on that. And that's going to show all of the information. That is critical for you all to know, because if someone is to come up and ask you, let's say I'm a vendor and I want you to buy my property so that you can construct your hospital. If I approach you, first of all, that's a problem because now that I've approached you, someone who's a potential decision maker, the federal rules say I can't compete for the dollars down the road if you give me any insider information. Now they can come up and say, hey, what's going on with the state mental health hospital? And you can point them to that website. And that way everyone is able to see the exact same information. No one gets any more or any less. We're posting things there immediately as they happen. But if you are to say to them, hey, we're actually looking for something, I don't know, I'm going to make this up for purposes of anyone watching this. I want it in downtown Wichita at Douglas and Broadway. Well, now you've given that person information that no one else has access to. That bidder is now precluded from being a part of it. And essentially, we have violated our responsibilities as decision makers under the federal rules by virtue of making sure that everyone has an equal playing field. So we need to be really, really cautious because I do think you are going to get hit up on a daily basis, especially once this type of stuff starts hitting the news and we start getting some momentum and an RFP comes out. And so to protect the county, to protect yourselves on this panel, to protect the integrity of the process, and really to even protect the vendors, we want to make sure that folks understand that they can't get insider information from you or they risk their ability to participate. Now, in terms of dates, we actually have, this is very scary now that we're in October 2023, we have until December 31st, 2024 to enter contracts and make obligations. So that means not only do you all need to figure out where this thing is going to go, we need to have an RFP process that gets us properties. A decision needs to be made about whether it's new construction or remodeling. And all of those contracts actually need to be negotiated and entered into by December 31st, 2024. And then even more scarily in the world that we live in today with supply disruptions and everything else, we actually have to have the project complete and paid for, which any of you involved in construction knows that this can be a trick. It all has to be done by December 31st, 2026. So contracts by the end of 2024, done, punch list completed, payments made from our ARPA budget by the end of 2026. Now, hopefully some of that state general fund, 15 million, might still be available for us to use past that 2026 timeline for any last minute things that we need to do, but we need to have a substantial completion by the end of 2026. And the last thing I would tell you is every decision that you all make, the considerations, the reasons that you make a decision need to be documented. So to the extent that it comes time to maybe discuss whether minutes are appropriate or even recordings of these meetings are appropriate, I would encourage you to keep that in mind because it's not just documenting the decision, it's how you got there. This is a project that's greater than $10 million and under the ARPA rules, it has special levels of scrutiny that are going to come in. And so we want to make darn sure that 5 years and after we make our last payment, when the OIG can still come and audit all of us in 2031, that even if we're not sitting in our seats, someone can pull up that document and say, here's exactly why this decision was made and why it was a good decision. So sorry for boring you for a few minutes. I appreciate your attention. And are there any questions or anything I can answer?
Yes, I don't know, maybe I missed it. How long is this committee? Is it an ongoing committee till 2026 or do we end after we make a recommendation to the legislature?
Well, for now, I believe your final report is due in June of next year.
Right.
Beyond that, I imagine that's up to whether.
March 31st of 2025 is when the executive order will expire.
Okay, so we will be part of the whole process of contracts and everything. Or is that?
In an advisory role,
Right.
providing
Yeah,
advice.
Okay, thank you.
And I think to the extent to which you all decide to do that versus delegating to staff is still a decision that's yet to be made by this committee, I would say. But again, as you all make those decisions, we'll just want to make sure to document that and say who's making the decisions.
I just appreciate the feedback you've provided us on vendors because I know I get emails and quite frankly, I just ignore them at this point because I
That's
don't
a
know
very
what
good
to
idea.
say.
That's just as good as anything. That way there's no record. Yeah. Okay,
Other
thank you.
questions? Thank you. Okay, our next agenda item is an update from the county on the hospital project.
Good afternoon, panel. My name is Tanya Cole, and I'm an assistant county manager in the county manager's office. And I'm here to give you an update on the progress of the design and construction of the building and next steps on the project. First, I just want to get into an introduction of who sits on the team that's working on the design and construction. I'd like to introduce the state of Kansas team that sits on for the design and construction. That is Scott Bruner, of course, the KDADS deputy secretary, Melinda Gall, who's the KDADS special project manager, Irina Yerominka, she's the KDADS State Hospital Commission Director of Operations and Program Management, Lindsay Dinkle, KDADS Superintendent of Larned State Hospital, and Ashley Biram, she's the KDADS Superintendent of Osawatomie State Hospital. For the Sedgwick County team, we have Tim Kaufman, Deputy County Manager, Andrew Diltz, Director of Facilities, and myself. And then for the architectural team, we hired GLMV and then also Pulse Design Group. They're out of Kansas City. They partnered with GLMV, who is a local architectural firm. On that team is Fred Britton with GLMV and Jeff Wyford. And then for Pulse Design Group is Dennis Burns, Basil Sherman, and then Loop Abkus. And so they are the firm that we're working with to do two parts of the design, and that was programming and schematic design. We started with programming and schematic design because, as Lindsay mentioned, we are on a short time frame to get started on this. And so we wanted to get started quickly. And so we knew based on an estimate that we were looking at about 63,000 square feet for this hospital. But again, that was an estimate. So we needed to hire a design firm to figure out what the actual square footage was for this hospital. And then we wanted to also do schematic design so we could have an idea of what that might look like. So we started with GLMV and Pulse Design Group. And so if I can refer you to this first sheet here, it looks like this. It's a programming document. I'd like to go over that in some detail. So we started that in August and we finished in about a month. And they came back to us with three options. Option one is looking at a patient count of 104. Option two is a patient count of 50. And that provides a 50-bed count. However, that provides the full administrative support if we were to expand to 100 beds. And then option three is just your full 50 patient bed and just the administrative support for 50. So I think what we need to do at this point is concentrate on option two and option one, because as we understand that we're looking for a 50-bed mental health hospital. However, our ask is to have that be a mental health hospital that expands to 100. So when I say let's concentrate on two and one, let me go over two again. That is a 50-bed mental health hospital with the ability to expand to 100-bed. That expansion is only going to expand for the patient units because the administrative support is already going to be there. The option number one has that full 104 bed count and the administrative support in there. The acres required there is 9. Acres recommended is 11. Now, what they told me is we can do 7 acres because there is the ability to double up on the units, the patient bed units, as well as the administrative support. So what I'm going to get into a little bit later is talking about we will have to go out and look for either vacant land if we decide to build new, or existing buildings if we want to go with an existing building. So if we do go out and look for vacant land, what I'm going to suggest is that we start with 7 acres as the minimum and go to the maximum acres of 11. And then parking required, you'll see there it says 141. Parking recommended is 225. So the 225 that considers patient's family as well as employees during shift change. The one thing I do want to point out in here is on the bottom, you'll see there that they have the acute unit, which is 14 and 12, and then the criminal unit, which is 14 and 10. And then you see it's kind of in green, 12 and 10 flex. What they're saying there is if at any point there is more of a surge on the criminal side or more of a surge on the acute side, the way that they're making this mental health hospital is that it can take more on the acute unit side or more on the criminal unit side. So they're making those units the ability to flex. So I will stop there and just ask if there's any questions that you might have on the programming piece. Yes,
Just a quick
sir.
question on
Yep.
the acreage that you quoted. So if it's 7 acres, the way to make that work under the scenario 1 or 2 would be actually going
That's correct.
vertical.
That's correct. And that's only if we get into a situation where we can't find acreage of 9 to 11, then we would go down to 7. Yes, sir. Yes, sir.
So this is an architect. Are there any hospitals operating that look like this?
Scott, I might lean on you to answer that question.
In the county or
no?
This design is similar to our Isaac Ray building at Larned, which was the last building that we constructed on a state hospital campus. It's got a central administrative services area and then patient wings that are in separate pods that are kind of flexible of how we use them. But the design is pretty similar. The unit size is based on our current model of what we think is the maximum number of patients you'd want on a sleeping unit that we can staff safely. So it's a multiple of nursing and other direct care staff per patient, and then what that does is a multiplier into how big of a sleeping unit you can.
So this model is working well.
In terms of the numbers and oversight, we believe so. Yes.
Okay. I think it's very helpful to go if there's another state that may have a hospital. I think it's very helpful to go look at that and talk to the staff there and make sure that it is user friendly. Sometimes these architects get a little bit crazy on what looks good on paper versus what really works for staff and administration. So just a thought.
No, it's a good comment. And we spent quite a bit of time talking with the superintendents at the hospitals, and we've actually shopped. We've got an internal team that's got more people on it just within KDADS and state hospitals that looked at the initial drawing just to say, is this the right unit size? And the big concern was sight lines. So as long as we can have a nursing hub that can see down all of the sleeping hallways, that's something we don't have in all of our existing buildings. So that was a key part. And then it was, how long is that sight line and is that sustainable? And then have enough space so that people can, the staff can get away to chart or have staff meetings or team things. So we do feel like we built that into this design as a workable size in terms of how many patients there are per kind of functional team.
Okay. Sir, do you have a question?
First, you said you hired an architectural firm to do planning purposes.
Programming and schematic design. That's correct.
Are they excluded then from participating in the actual construction and the design? Does it conflict?
No, they wouldn't be.
They're not, but they have the opportunity of doing all the preliminary work. And then they can also bid on doing the architectural work.
That's correct. So and one thing I'll talk about is the next thing that we're going to do after this is twofold. And I'm happy to get into that piece now, and then I'll go back to the schematic design.
I have a question for you.
Okay.
looking at this, are we looking at a pod for 50 and then another pod for 50? Or how is that being handled?
So option 2 is a mental health hospital for 50. And then option 1 would be a mental health hospital for 104. But what we're looking at right now is, my suggestion is that we would go out and look for a existing building that is from 76,000 square feet to 111 square feet. So that gives us options. And we would also look for acreage from 7 acres to 11 acres. That gives us opportunities to see what's out there. We are not going to build a 100-bed hospital. We're going to build a 50-bed hospital, but we want the ability to expand for the future to 100-bed.
Other than land, but you're talking about all the other systems that would be support, the heating, the air conditioning, et cetera, the electrical. And that's why I asked the question, are you doing in a pod system? So you add one pod for 50 and then another pod for another 50? Or are you putting in all the hardware and all the guts for going to 100 bed eventually? And hopefully we get to that point.
Yeah, I mean, essentially you would be building the mental health hospital, that all you're doing later then is adding your pods and your day rooms and so forth. So you can see in the schematic design, you've got your essentially your beds that come in later.
It might be good to just reinforce, because it doesn't show up clearly here, but so in the 50 beds that the legislature directed us to build, half was supposed to be for forensic competency evaluation beds and half for care and treatment, involuntary commitment. And in our world, those are two separate activities, separately certified, separate levels of security. So they're kind of different. So what this layout would show you are two 25-bed pods, two units of around 12 and 2 units of either 14 and 10. And so you're building in that pod kind of essentially 25 at a time to get to. So if this design is for 50, and then if we could go to 100 or had the funding to do that, we'd add 2 more pods like you'd see on the schematic here, but still trying to keep that separation of the function.
You okay?
I had a quick question.
Sure, Natasha.
And so on your renderings here are schematics and you have your future. Is this shelf space in your guys' mind, or is it like you'd actually have to add the infrastructure?
We would add the infrastructure later. Yeah.
Are there other programmatic considerations that go beyond the physical building, meaning proximity to arterials, or I don't know what those might be, but beyond the program of the actual building, is there other considerations that
I don't think we've gotten into that depth yet.
Is the idea when we go to the next step, RFP, will that be considered those kinds of ancillary things? I think that's up for this group to talk about, right? And give input to it. And then just from a technicality standpoint, when we go to RFP for the next step, back to Henry's concern, now that you've got schematics, any architect can come in and look at these schematics, it's fairly standard, and put in a logical bid on development of it's a whole nother project now at this point. Will this group be oversight on that RFP? Will we have our usual policy where we'll have other people potentially overseeing the RFP?
Well, and that's what I wanted to get into is those are the 2 next steps that we have to do. I have to put out an RFP to take it from design development to construction administration with an architectural firm. That's one step. The other step that I want to do at the same time is have our on-call real estate broker go out and look for vacant land that fits these parameters, as well as existing buildings. What I need to understand is, what are the parameters for what an existing building is going to be? I have this piece, the very basics of, what a square footage looks like. What are the other things that we need to be looking for in an existing building or vacant land? And, those are the things that Jason brings up. If there are other considerations that we need to look at, And what I would like to do is bring that back to the committee. And I don't know if those are subcommittees or what that looks like, but we haven't moved forward on those two pieces in anticipation of waiting for this panel to come together. So this is as far as we've gotten. Again, in anticipation of this panel coming together to bring forward these two next steps.
So if you look at existing buildings, when we think about a psychiatric hospital, definitely needs to be gutted and look very different from that. Are you thinking about demolishing an existing building or gutting it and then replacing it with something?
That's a great question. I think that'll depend on the condition of the building.
I'm just thinking if this is a monthly meeting, how is that going to conflict with, because your timeline's pretty aggressive.
It is very aggressive, and it's aggressive because of the dates that Lindsay put out on as far as getting contracts in place and then getting the building complete.
So I guess, are we going to be able to provide you the input you need in a timely way?
I think you would. I mean, I think the timeline that we put out, I think what I need to hear from the committee is I'd like to move forward with putting out our RFP for architectural design and being able to get our on-call real estate broker on board to at least begin looking at vacant land and existing buildings. What I can then do is, have a timeline of coming back to present to the panel what we've received for RFP on architectural and engineering, and then also to report back out what we've seen for land and existing buildings.
Quick question.
Sure.
Have you guys thought about qualifications that you're expecting on this project? I mean, is this part of this group's task to say, we believe that the architect selected has to have ABC experience or similar projects in their past, or what does
Sure.
that look like for you guys? What does the RFP look like?
We typically will put that together in our RFP and we can share that with you. We have a template of an RFP ready for the A&E, so we can share that with you.
Just a quick question. In these renderings and in the options being considered, are there any other non-inpatient programmatic things that were contemplated when these models were considered? In other words, maybe not so much for the criminal side, but maybe for the acute side, some intensive outpatient or something that would augment in lieu of a inpatient bed. So in other words, that expansion zone, could it be for something different than an inpatient bed that may not be as costly or maybe a transition into the community? Maybe I'm not stating that right. You know what I mean?
No, I understand the question, and our programmatic, the specifications that you saw here are 25 inpatient beds. And then what we would need to support that, we wouldn't have this. I think the staffing model and the treatment approach is different if we were doing intensive outpatient. That's just not the model that we'd have in a state psychiatric hospital. Now we have people have floated other maybe buildings that are available that would have much more square footage than this. And if there was an opportunity for somebody else to operate something else in the same physical structure, that would be a possibility. But in terms of what we would operate, it's an inpatient hospital setting.
A couple of questions have been asked about the role that this committee plays in the maturation of this project in terms of, do we get involved in the RFP? Do we get involved in improving things? And I'm just reading back through the charge from the executive order, and it speaks always in terms of recommendations, shall be considered advice to the governor and KDADS in the county, not official policy. So I think we need to give our opinion on where things should be, how things should be done, et cetera. But I don't see anything in this charge that we were given that gives us authority to dictate the terms of the RFP or which architecture firm gets the bid, or which construction firm gets the bid, which piece of land is bought or not, just whether or not it fits within the recommendations put forth by this. So maybe everybody understood that, but a couple of questions were asked and I don't know if we.
Mark, I was
ironed
looking
that
at,
out.
I was looking at 5 under responsibility. 5AE have final approval of design site location. This, the way I read this panel has a final, I mean, we recommend recommendation to the secretary. Is that correct, Scott?
If there's I think what we're looking for is advice from this group about things that are non-starters or things that we should avoid. I don't think we're going to get to the point of bringing you 3 RFP responses and asking the panel to choose between them. But we do want to know, I think the advice that the governor is looking for is, are there elements that we just should definitely would be a non-starter in the community? Placement wise, location wise, service wise, being that level of advice.
And I think just to clarify, I was referring to the executive order, which is what created this body.
Right.
The MOU, I think, is what maybe you're looking at, Tom. Maybe I'm between the county and the state. That would be more specific. So. Or, yeah.
Oh, sure.
But you answered the question. I mean, Scott, that makes sense.
Yeah.
We give advice, and then the technical side of this will still be done by staff.
Fine, go ahead.
Okay, I don't have anything more. I think we kind of covered the schematic, unless you have any questions on that. The intent there is this is really based on a new build, but the idea here is take this block diagram, because this is really a block diagram. It's not a schematic. They're still working on the schematic piece. Take this block diagram and understand this is the intent if we were to build this in an existing building. This is kind of split down the middle, if you'll see. So there's one side that's the criminal side and one side that's the acute side. And the intent here is that this is what you would see in the mental health hospital. There'd be the lobby waiting area, the screening area, facility support, and then the administration piece here in the middle, where you'd have your case managers and so forth. And then there'd be the patient units, again, half side acute and the other half criminal patient units. And so again, what you see grayed out would be for the future, that if we ever move to 100 beds. So that's the block diagram. And then I just wanted to share with you all kind of the timeline that we're looking at. Again, design would take about 7 months. That would occur in 2024. And then we would move right into construction. And we're estimating about 24 to 26 months on construction. And that would get us to the end of 2026. So happy to answer any questions there. But again, I kind of went over what the next steps are and what we'd like to do after this point once we get schematic completed with GLMV. Yes, sir.
I just have a couple of questions. So if we're looking at an existing building, it could basically handle the orange and the brown area here on this one schematic. And then the wings, so to speak, could be built off of that existing building.
I think it would depend on what the existing building is
right.
like, but yes, that again, that's the intent here, is that this is what the adjacencies would look like for an existing building. This is how we would want it to be set up.
And my experience being how expensive it is, and we've remodeled down at Osawatomie, and it is very expensive to refurbish a building with line of sight, with no constriction, no ability to hang yourself, those doors. I mean, all of that stuff is very, very expensive. I think that would be, we would have to look at it, but it would be, I think, very cost prohibitive to try to remodel a building with that kind. And it already is cost prohibitive. We've spent a ton of money doing that at Osawatomie. And I think it's just, we should have raised the building and started over.
Sure. Okay. Thank you all.
Any other questions for Tanya before we let her go? No, nobody else asked about it, but since we have these kind of two separate purposes, and we essentially said we have to replicate a lot of the support activities on both the criminal side and the involuntary side, that's why there's two gymnasiums. We don't it's not, we thought about building one and then dividing up the time. But kind of our certification requirements are to keep them separate. So we're starting from that as a point, which does make it harder to find an existing building where that would make sense. But we are excited about the concept of building a new patient unit where the lines of sight are exactly what we could build for ease of nursing coverage in terms of some of the things Representative Carpenter has talked to me about in the past in terms of the number of staff it takes to operate one of our existing buildings because there are blind corners or long hallways. We think this gets close to kind of maximizing the space, patients and staff so that it's the most efficient use of the floor plan. Yeah.
So just one thing, and Sheriff, I don't want to put you on the spot, but how many folks do you have waiting for competency and evaluation in your jail right now?
So I was waiting for that question. We have 26.
Okay.
And so, that fluctuates. And, the lowest we've had in the last 2 years is 14. And so, the longest that we have waiting around of the 26 right now is 485 days. I just ran the numbers Friday before this meeting. But understand also that some of those folks have been gone to Larned for assessment, and now they come back to us to be put on the list to go for treatment. And so because there's 26 sitting there waiting to go to Larned, that would be a faster rotation, in our opinion, when this is built here. So you wouldn't have those 26 beds occupied the whole time, or 25 beds just from us.
Correct. So I'm just getting around to the point that I've made throughout this whole process is that I don't, and I would stand corrected, but I just don't see mental health going away as far as the need. And I have definitely, it has to be expandable for sure. But I also think about the egg that will be on our face if it fills up day one. And that's a concern, a big concern that I've had from the needs that I've seen. How many do we have waiting for services now? 15, 16 down at Osh.
Yeah, in that
average, so we could fill this, I'm just saying we need to think about that. I just don't want the bad publicity that we entered into and built a new hospital that was filled day one with no room.
Well, and what I'll add to that, and Mark, could speak to this more, is we've had 5 or 6 homicides in the last couple of weeks here in Wichita. How many of those folks that their attorneys are going to say have mental health issues, and then everything stops? That's a roving number. We just never know when that's going to happen. A question I would have, because basically the criminal patients unit area is a jail, because you're taking people that are in custody of sheriffs. I know from our standpoint, when we look at our jail, if we could rebuild now, we would love to, because we would not design it the way it is now. And especially because of staffing purposes. And so I don't know if this has been taken in consideration, at least because I know you have nursing staff, but you also have guards. And so I don't know how this is set up. And that's something else I'd be interested in the design of at least the criminal patient unit. How many guards that takes for that unit, because the new gelling designs is up above everywhere is where the guards set, so they can watch 4 to 5 pods at a time instead of one deputy in each pod, which saves staffing. So I don't know if that's something that's been considered in this, but that would be a suggestion that I do have.
So I'm going to take that as a question to me. So we don't have guards. We have safety and security staff that supplement the nursing and direct care staff on that criminal unit. The interactions would be between nurses, what we call mental health disability techs. So direct care staff that have some training in mental health observation, de-escalation, and safe holds, but they're not security. Our security staff come in or called to the unit when there's a disruption or someplace, or we need to, if we need to administer medications or somebody's disruptive, to lay hands on a patient in a way that's more aggressive than we would in a treatment mode, to either restrain them or whatever we need to do to keep everybody safe. So we did talk about in terms of this design, kind of where security would be based, how they would be dispatched to the unit if they needed to respond. This just this design compared to what we have on the other two campuses is a huge leap forward, because now on the other campuses, we're in multiple buildings across multiple acres. And so there's a lot of travel time. Here, everybody's under the same roof. So that should speed things up. We also have the ability to install cameras here that we are retrofitting now into our units, which makes it easier to observe and keep observation going. So in terms of we'd call it treatment milieu, it isn't different because they're secure or criminal defendants. We treat them like they're a patient, and then there's supplementary staff if we need to engage in a way that keeps people safe.
Just to answer your question quickly in terms of whether the numbers are going to go down anytime soon. Competency evaluations that my office handled just in Sedgwick County over the last few years, the numbers were 159 cases, 158 cases last calendar year, 2022, 159 year before, 138 in 2020, compared to 55 in the year 2012. So they've just gone steadily up, and we're triple what we were 10 years ago. Now, does that mean we're going to be triple where we are 10 years from now? I don't know, but it certainly is no longer just a blip in the trend line. Look at 10 years and tripling the number. To me, that's indicative of longer term consequences. We'll say on the other side of things, the care and treatment for the acute care folks, because of the crisis center and a few other, and frankly, because of Ascension, their willingness to step up and help as well. We've been able to stem the tide. We were at nearly 900 10 years ago, and last year we had 346 care and treatment cases, which is considerably down. In 2020, we were at 449. 2017, we were at 662. So I don't want to just inundate people with statistics here, but the criminal side of things, I don't see any end in sight. The care and treatment side of things, we have collectively as a community, again, tip of the hat and public thank you to both ComCare and Ascension, because we were getting closer to, we were clearly going to hit 1,000 of those a year. And we're down now to a third of what that was because of collective community-based efforts. So.
And ComCare does your competency evaluation.
Does the initial screen, and if the person's declared to be incompetent, then they go to LARN, and that's where the weights come in the jail. And if they're declared to be long-term incompetent, then again, more weights.
Let me clarify that though. They do most of the screening, about 70-75%. The ones that are in very acute, have severe mental health illness issues, Larned comes down or we transport to Larned, they do them there. ComCare doesn't do them, but they do about 75%. It's a huge help.
Yeah, I just want to say, I think, when being in Riley County and looking at all of the discussions, we're having similar discussions across the state as well. I think mental health is definitely a crisis. I wouldn't be surprised if the beds got full really fast. I mean, Kansas was 50th or 51st in the nation for mental health needs, or attending to mental health needs, let's say. So there's a definite urgency, and we haven't even looked at the children and adolescents yet. So we're just hitting the severest cases right now. And I think, the faster we do this, of course, the better, but there's certainly, it'll just take care of a few needs, and there's just so much there.
Scott, can I ask you a clarifying question for the group? When you say youth, is that 18? Because I know different groups have, 24 and under, or can you specify that age for all of us?
18 and under.
It would be 18.
There is a private hospital.
We have private hospitals that take
Maybe one last comment on the design. It in this level of review or schematic, it doesn't show up, but to the sheriff's point, because of that forensic competency side, we're dealing with criminal defendants who are ordered to a state hospital or this building by a court. We have to keep them secure. So we have talked with the designers and architects about how to capture that some part of this building or the whole building would have to be behind a fence, or how that would look. I mean, if it's an existing structure, how that would have to be designed. But in terms of kind of the advice that we're looking for from this panel, in terms of where to place a building or places that are maybe not off limits, but would be a lesser preference. I mean, you've got to think about a building, a significantly sized building that's behind a fence that's meant to be secure and keep people inside. That may not be something everybody wants in their backyard or, next to their development or their church or other things. And there are ways to moderate that. And other states have found ways of, you still build a fence, it's still a fence, but it's a nice looking fence. And so we can look at that in the design as well. But that would be, in terms of the considerations, asking about what advice or what recommendations we're looking for. Do keep in mind that part of this building's got to be secured in a way, not just, it keeps people in. We're also, keeping the community safe as well from people who are dangerous. The sheriff and.
So to Representative Carpenter's statement on an existing building, that's the problem with this, because you're building a miniature jail. That's what this is. There's no doubt about it. You call it safety and security. Okay, it's the same thing we're doing, keeping the inmates safe and secure. But when it comes to the type of doors you use, the type of suicide assisted areas, because you have this setting here, or that setting there, we're building a miniature jail is what this is. And so, which is extremely expensive. And that's why I think we have to be very diligent about how we do this, because you're not going to get a second chance at it.
Right. Exactly right. And there'll be a fence. So keeping that in mind, this will be a building where the sheriff or some of his deputies are going to roll up in a sheriff's vehicle to drop somebody off who would need forensic evaluation or could be care and treatment. That's behind a sally port, multiple fences, multiple gates. So again, where that may be a concern for the community or other residents or things that to definitely keep in mind. Other questions about the preliminary design? We did have to move because of the timeline. We didn't want to let a whole lot of grass grow under the project. So engaging the architects to say, well, let's capture what we think we know now and what we need to work from to have that starting place. So that's definitely what you're looking at in the drawings that we've got. So the last item before we adjourn is just to talk a little bit about future meetings of the group. We are by the executive order charged to meet monthly. So keep that in mind. We do have some work or advice that I think both the county and the state are interested in as we go into this next round of selecting somebody to do the architectural drawings and construction. So I think that highlights the need to meet over the next couple of months. We my staff, our staff talked about, is there a way to find a regular meeting date that would work with folks' schedules that we could land on? And we've talked a little bit about this is the second Monday. That won't work in November for us, but we were thinking of dates like November the 6th and December 11th as two next possible dates. If you want to look at your calendars and let me know or think about those as possible dates for the advisory panel to meet. The other part that we need to incorporate is public input. We can certainly do that at this meeting with all of you in attendance, and there's a place for that. But we also thought maybe to gather public input to have a separate session where the public was invited and gather their feedback about the project with a high level description of what it looks like, where we want their feedback in terms of service coordination and location, some evening times when it'd be easier for people to get to places where where it'd be easier for folks to get to as well. We could do that. I think my proposal would be to do that outside of this meeting. Invite all of you. You're more than welcome to attend, but try to have a place to gather that input. We'll summarize it and then bring it back to the panel to say, this is what we heard when we talked to the community. We did engage a facilitation contractor to help us with that process and also with these meetings. We worked as fast as we couldn't get it done for this meeting. So you were kind of stuck with us doing the arrangement, but going forward, they'll help us out. And we're almost done with the contract and notifying everybody. So I can't say who the vendor is, but so they'll help us with both this meeting facilitation, but those public meetings as well. And really just as a way to kind of, in the same way that maybe the county or city would do a public works project and talk about, here's what it looks like. What do you think? Gathering that information. So we've got to get that done in the next couple of months as well, and figure out the timing. But if others have suggestions, and we do this some at the state level, but you're all much more informed about the community here, what would make sense and how to gather meaningful input. I'm happy to take suggestions about that while we're thinking about when the advisory panel would meet again.
What were those 2 dates again? December 11th and what was the other one?
November 6th.
Thank you.
Scott, I would just say if we're going to do a town hall or some type of public get together, we've got holidays coming up and we try to avoid that Thanksgiving to Christmas time.
Sure.
So, can that wait till right after the first of the year, or does it have to be, should it be done earlier?
No, the issue is your deadline of your reports. You got one coming up in January and then final. So if you want to include it in the interim, then it'll have to be sooner. If you can wait, then not so much.
I think we would want to get some initial comments back from the public. And maybe that's an informed public. I mean, kind of key stakeholder would be a little easier to gather than a open call community meeting. But I think we've got a few weeks, knowing we need to avoid that. So if we can get it done before Thanksgiving,
What about
the end of October, and
what about a time between November 6th and Thanksgiving? You'd have 2 weeks of week of November 6th and 13th, and Thanksgiving's on the.
I think we'd be able to. We'll try to get something in then, or right at the end of October seems optimistic, but that kind of after this, if we would meet again on the 6th, between that and our next meeting date, try to get a public session or two in.
Are we thinking 1 to 3 on November 6th?
That was my suggestion. Yeah, the same time, just those Mondays.
Scott?
Yep.
Means the deadline that we're going to announce here at the location of this is going to.
That probably won't be until after the first of the year. Until we've got, so once this initial architectural work is done, we can shop that to the county's real estate vendor. Maybe Tanya, if you want to talk more about that, or the timeframe for that, but kind of after the first of the year is where I sort of targeted it.
So I see the timing to get with the real estate broker on your timeline about the same as getting the RFP out for the A&E design. So I think that's probably correct that we could, we'd probably want to identify towards the end of the year or the first of next year, whether or not we're going to do existing building or vacant land.
I'm guessing that as soon as you announce where this is going to be, you're going to have more people wanting to come and testify at that point.
Good point.
Regardless of wherever you do it. So you're gonna, if you do one, plan on having a second one when you announce that it's going to be located at blank area.
That's a good thought, because then it's not about hypothetically where it's going to be, but how it impacts the area where it's actually going to be built.
Yeah, and you'll not only have general public, you'll have a lot of legislators that going to start getting interested.
That's a good point.
One of the things that I would suggest based on the manager's comments, there is about 80 different entities through the Sedgwick County and the Mental Health Substance Abuse Coalition that have been working together in this area. That might be the first group that we engage because they're kind of the stakeholders of mental health, homeless, substance abuse, all kind of related issues. And we've been meeting with them once every about twice a year already. And so that's something that we might be able to get put together fairly quickly in November. And that's at least your stakeholders, folks.
Right.
If we need to have one before January 1st.
That's a good thought. Any other, for some of you that participate in that group, does that seem like a logical way to? It's a different, it's public comment, but it's not the general public. It is an informed community, but that's an important stakeholder group to engage, certainly early on. Good suggestion. Any other warnings about public engagement process that?
I just want to say I need to excuse myself. I need to ride back to Manhattan. I apologize for being late. I didn't know where to park, so I was just fumbling around with that. I have a 5 o'clock meeting, so but I appreciate being part of this panel, and I think this is a lot of good work we're doing, and I really appreciate all of the discussion. And I will stay tuned for everything that's coming up and pass the word to the other constituents in the other areas of this region. Thank you.
The last item that I had on the agenda was about sub panels. The executive order does anticipate there may be some subgroups of either of the 14 of us. And I think that would include maybe bringing in some other experts if we needed to deal with or work on particular issues. One in particular was workforce. I thought if having a subgroup of this panel maybe called together and working with Wichita State, with the osteopathy school, with some other folks that are in the education and training environment, might be a good way to jumpstart that workforce discussion and pipeline, and maybe identify some recommendations. Are there other thoughts about sub panels or topics that you think would be well suited for sub panel activity that we could start working on and planning for?
Just say that from having been on other committees like this with a particular agenda from the legislature, having a subcommittee that can generate a report will help the production of a report in such an expedited time frame. So if you want to know from law enforcement's perspective, Jeff and I and Tom or somebody get together, at least say recommendations to this group to be included in the interim report. This is what's on law enforcement's mind, things to be written to, where this is located, consider the number of times the sheriff will have to transport, just all sorts of things like that can be included in an interim report. So while subcommittees are kind of a pain and take more time for somebody, if you're going to get any sort of interim report back to the legislature that's going to be anything other than a
thank you for
70,000.
volunteering.
Yeah. I think we could, I guess my point is the more subgroups, the better in terms of getting meat on the bone for this report. So I'd suggest law enforcement.
Okay.
I think the workforce is important. You could get as granular as you want. You can have a business perspective. What's the business community want to see out of this? What does the mental health community, but the hospitals, the healthcare, just in a very general sense, what are they looking for? I don't know. I think you'll have a more robust report if you do that.
Our vendor, and that's part of their contract as well, to draft the report. That's good direction to them to work or specifically look at some of those sub areas for either comment or parts of the recommendations. That's good.
And Scott, back to my previous deal, one would be, and I'm certainly not looking for any extra work, that's for them to, but the design is just I think boots on the ground people, I think that we should be able to find someplace that is similar to this, maybe architectural wise, and go visit that and see what the boots on the ground people really say about the operation of that facility. In a previous life, I was county commissioner. We built a new courthouse and we went to other courthouses. And man, did we get a lot of ideas about, for instance, nowadays it's very common, but putting in enough infrastructure where you can do all your electricity and stuff like that. They had built theirs and they didn't have any kind of conduits where they had electric cords on a new courthouse running across the floor. They were trying, that was in, technology was really catching up with them and they had wires, just saying, I think that that's a very important part, getting people that really do the job. That's something that's truly functional.
One other question, maybe I missed it in the executive order. Can you have folks not on the committee be on these subcommittees? As long as they're chaired by a member of this body, because if so, then you can really get more hands on deck to help. I don't know what the rules are in this. Maybe somebody's read it closer than I have. Sorry?
Number 9.
Number 9. All right, very good.
The language says it's a sub panel of the 14. But I think if we needed to bring consultants in or provide testimony,
sure,
that would involve others as well. And I think we'd be missing the point if we didn't use that mechanism to draw in get other feedback and other comments. They're good, great suggestions. You want to respect everybody's time. If you have other data questions, other questions in the spirit that you've already been asking about the operations or research you'd like me and my team to work on to bring back to you, happy to do that. Should all have my email address, but I'll send it out to the group just to make sure we've got everybody's emails and we're all connected. Happy to work on that. We'll work on an agenda. And if you could look at those dates of November the 6th from 1 to 3 and December 11th from 1 to 3. I'll send out a reminder about that. If you could weigh in on that in the next few days, maybe by this time next week, that we can get those other additional meetings scheduled. And just to make this more complicated, we have our additional vendor helping schedule and facilitate. So that's another party. We'll try to keep that simple, but
the last thing I suggest is, because this wouldn't be any sort of vote, but in terms of getting back to you, if anybody has a suggestion for a subcommittee and wants to volunteer to be on it, send you an email. It's just for scheduling and appointment purposes. You could come back and make the final thing, but we can get more done in a quicker amount of time. By the next one, we come back again.
And if it helps, that we'll provide, or I'll provide from either myself or my team, somebody to help staff any of those subgroups to gather information, contact people. So the work that you're all doing is thinking, planning, drawing people in, but we'll help with the documentation and scheduling and that part, just to make it hopefully as administratively easy as possible.
Scott, does the sub panel or the vendor who you're using to help facilitate, are there already some constructs around what you might be looking for from like providers? What kind of input would you be seeking? So that if we did form a group of experts, sort of, we want your input on these 5 questions and we can provide that to this group. Is that already been drafted or?
No.
Okay.
Well, other than what's in the executive order is the key questions we have to answer. Okay. They do have that. So if you wanted to go into a more, there are in the workforce topic, for example, there are sub themes within what's in the executive order. If you wanted to frame that in the form of a question, that would be something they could answer and work on. Or say we want to make sure we include all of the hospitals in the South Central region and talk to all of them about what their needs are for mental health or how they see the admission pattern working. Be more specific, but there are some elements in the charge to the panel that are a little bit narrower, but not. And so that's what the the contractor has to start from. I don't know that that's the first thing we need to have, but it's not very far down the road. I agree with you, John. And that's when we want more folks from the state hospital to the existing hospitals to kind of talk about what they see now and traffic flow, what works and what doesn't work. All good suggestions.
I think we are under a timeline, but I think it's just as important that we get it right. I think there's some flexibility in there if we need to move things out, but I think if we run up against a brick wall or something, we just need to get it right.
Yeah, this is not once in a lifetime, but once in a very long time opportunity to build something new. And we do want to get it right or as close as we can. That process. Okay. Held you over by a little bit, but thank you again for your time and your attention and questions. And if you can, I'll send out an email to remind you, but if you can think about November 6th and 11th, December 11th as two possible dates to reconvene, that would be great. Thanks again for your time and attendance.